Sit it next to you. He says, we got a sound, you can get it. 10 o'clock.
Good morning, Decatur. It's hard to believe that we're halfway through September. I just want to take a moment to thank you, our community, for all that you're doing to be considerate neighbors. Thank you for wearing your mask, for checking on one another, and for continuing to support our local businesses. I am proud of our residents and businesses for every step that they're taking to keep Decatur safe. Please know that it does not go unnoticed. Today with us, we're fortunate to have two guests. To my left, we have our Superintendent of Education of Decatur City Schools, Dr. Michael Douglas. Dr. Douglas, good to have you with us today.
Thanks for having me.
To my right, we have with us Decatur pulmonologist, Dr. James Boyle. Dr. Boyle, it's a pleasure to have you with us today.
Good to be here.
I know you're going to be able to offer a more in-depth perspective of impacts of COVID-19, so we look forward to what you have to share. So just a few municipal updates. Current Morgan County COVID-19 cases, we have 2,962. That's still about 2.7% weekly case increase. Very similar to last week, so let's stay the course, Morgan County. Please reach out to the City Hall departments that you have business with prior to making a trip. Oftentimes that can, a phone call or an email correspondence can save you a trip to City Hall. You can reach us at DecaturAlabamaUSA.com and get department phone numbers. Just a reminder that fall is next Tuesday, and with that comes leaf collection. And so mark your calendars and start raking. Fall leaf collection will begin October 1. First, we'll start in the Flint area and moving counterclockwise throughout the city. Also remember, if you haven't done so, to complete your census at my2020census.gov or by phone at 844-330-2020. Your input helps to direct federal funds for schools, roads, and other public services, as well as a congressional seat. Also want to encourage you, as we do each week, to call someone in your neighborhood and check on them, especially our elderly neighbors. I know they value that. So with that, Dr. Douglas, how are things with the school system?
Thanks for having me. We put out some information last Friday. We report only our active cases, and last Friday we had 5 students that had tested positive for COVID-19. One at Austin Junior High, one at Austin Junior High, one at Austin High, one at Austin Junior High, one at Austin Middle, one at Ben Davis, and one at Decatur High. We currently have 151 students who are in our quarantine self-isolation. I realize that's probably been the most frustrating, but if you've had a relative at home that tests positive, or if you're in that 6-foot window for more than 15 minutes with a student that tests positive, really for the safety of everyone, we really have to follow that quarantine protocol. And our parents have done that, but it's been very frustrating for our parents, and I know, but that's what's allowed us to keep the doors open, because I think the reason we've had few cases of students is because of the quarantining that we've done. In terms of faculty, we currently have 2, one with transportation and one at Walter Jackson. And then we have 34 faculty members, staff members that are currently in quarantine isolation. Our enrollment, we're kind of getting to that where our enrollment's going to be, 8,764. That's right where we were last year. I was extremely concerned with the pandemic that we would lose numbers, and that would cause us in turn to lose teacher units, but we've held where we are. We currently have 1,824 students that receive their education virtually, all from home. And then we have 6,940 that are traditional or /blended. Blended's kind of our hybrid model. Every week, I feel like instructionally we get stronger. The face-to-face was probably strong day 3, because that's what we've always done. But trying to open up a school year where you've got kids at home, kids in place, and then you've got kids that are coming and going, it's something we've never had to deal with. So we feel like our virtual instruction has gotten better every week. And then the tough one is the quarantine or the blended kid. They're in school, they want to be in school, and then you have a 14-day. More and more our teachers are with more and more professional development, they're actually logging in, particularly at the high school level, where you just log in and there's your teacher, and she interacts with you at home and interacts with the rest of the kids face to face. We have found that through experiment. That's probably our most successful. That's better than videoing and putting it out there. But if you can actually patch in to where you're essentially seeing the lesson as it happens, then you don't miss out on that good discussion that goes in where a lot of good learning occurs. You know, the big message we've had is, you know, we're going to do the best we can. Every week we get, we feel like is good, but we're also very aware and getting prepared for, you know, if we were to have an uptick, you know, what would our next step. So tell your teacher thank you. I cannot tell you, this has been probably the roughest year to be a school teacher, just because of all the expectations we put on them. And, you know, I think Labor Day hit at a good time. And I think fall break will hit at a good time because just the wear of and the responsibility of, you know, I have a lot of teachers that they want to provide the very best, and when they don't feel like it's the best, you know, they take it hard. And it's just hard to be all things to all people, and that's what we've asked of our teachers, and they're doing as good as they can. But, you know, it wouldn't hurt if you're out there, you know, just give your teachers a little thank you, appreciate what you do. I think it would go a long way. I always say, a little positive comment, positive things happen to positive people. So we're trying to stay positive in this uncertain times. And, you know, we hear the frustration sometimes, but, you know, when I talk to my colleagues across the state and really across the nation, everybody's dealing with the same thing. And I really feel that we're doing it as well as most. So that's about all you can do. But thank you for having me.
Sure. So we'll start with a thank you to our superintendent and central office staff, and appreciate what y'all are doing. I know just by spending time with you that you're a big proponent, fan of in-person instruction.
I am.
And so to talk about how actually now for those that are coming in online and being a part of that, I know I would learn better that way as opposed to having to look at just some type of instructional video. So hearing the discussion and such, so good job.
Will do. Thank you.
Yes, sir. All right, Dr. Bull, thank you so much for joining us.
It was my pleasure, Mayor.
Yes, sir.
I'd like to start off by commending Dr. Douglas. You know, I can't think of a harder thing to do than save public school education, and it seems like y'all are doing a really good job. Hope the numbers stay low for y'all. Again, I'd like to thank the mayor for allowing me to say a few words about our local hospital, Decatur Morgan Hospital, and the coronavirus pandemic. For you that don't know me, I'm a pulmonary and critical care physician. I was born in Decatur General Hospital when it was Decatur General. I grew up here, went to Austin, go Austin. Big Roll Tide fan, we'll save that for later. And came back in '98 to open a pulmonary and critical care practice. I also work with Hospice of the Valley. And I've been blessed to take care of people of Morgan County in the city, and it truly has been a blessing. Let me start with a few numbers. As you might have known, the number of cases in the state, 138,755 cases with 2,351 deaths. That's for the state, that's one death for every 59 cases. For the county, there's been 2,962 cases of coronavirus, as the mayor said earlier, and we've had 24 deaths, and that's one death for every 123 cases. So I think we're doing better than the state as a whole. Number of coronavirus patients currently in the hospital is 18. Current patients under investigation for coronavirus is also 18. We currently have 4 patients on ventilators. That doesn't include one patient who's been on ventilator for almost 3 months that doesn't test positive anymore for coronavirus, but a very sad case. After the pandemic reached Morgan County, the number of cases in our hospital slowly climbed, and we peaked around 22. Our sister hospitals had a delay before their numbers started to climb, but they they have peaked and have started dropping their numbers faster than Decatur Morgan, and I'm not exactly sure why that is. If you follow the county numbers on the ADPH website, you'll notice that the new case rate has trended down, and that's encouraging. And a Monday a week ago, the lowest cases I saw was 4. I mean, they had 5 new cases that day, and I probably celebrated, maybe not out loud, but this can change quickly. And if you follow the trend, 2 days ago the case rate had spiked back to 20. We can't let our guard down. We have to continue to remain vigilant. I know this is fatiguing. We all want this to go away. The pandemic has placed a strain on the medical system across the U.S. It's been no different for this county hospital or any hospital in this state. Fortunately, we have had the resources to take care of all of our residents that have contracted COVID in this county. We've had access to all the standard treatments that you'll see on the news. We've had no difficulty getting remdesivir. We've had no difficulty getting convalescent plasma. We continue to struggle where the best place to use these modalities. And we follow the trends in the country to figure out what's best for each patient. We have not had a ventilator shortage. Make sure everyone knows that. We currently have adequate rooms and staffing to take care of additional patients in this county, but I can tell you that this hospital and many hospitals across this country will fill to capacity if we have a coronavirus surge in the middle of an influenza spike. And it's up to the citizens of this county to prevent this, and I beg you, we repeat this over and over again. Please do the following. Wear your mask. There's no question in my mind that masks save lives. It may be your life, it may be a loved one's life, it may be a loved one's life, it may be a stranger's life, it may be a healthcare worker's life. Please separate and sanitize. I know it's redundant, but we all need to do it. We got to repeat this. Please quarantine if you become ill. If you came back from Sturgis, please quarantine. Please get the flu vaccine. Get the coronavirus vaccine. I know there'll be controversy. I'm just waiting on that to come about the controversy with the coronavirus vaccine. I'm going to have to suffer through all of that in the news. If the mayor wants to give me a shot, I will come and let the mayor give me the coronavirus vaccine right here on live TV. And last but not least, everybody's stressed. Everybody's stressed. Just be kind. And like the mayor said, check on your neighbors. I'd like to thank all of my colleagues that I work with, including the administration at Decatur Morgan Hospital, the nursing staff who truly are heroes on the front line, the medical staff, all employees at the hospital that make it function from dietary to housekeeping. And I'd also like to thank Huntsville Hospital. That partnership has clearly given us resources that we wouldn't have had. I'd be willing to answer any questions.
Thank you so much, Dr. Boyle, and just want to emphasize your encouragement to be kind. We're running a marathon here, and it is fatiguing.
It is fatiguing.
Yeah, but kindness is pretty easy if we're conscious about being conscious of that. So I think you did an editorial or participated in an editorial op-ed maybe.
I think Eric Fleischauer wrote a piece, and I'd like to commend Eric. I thought he did a really good piece on that. You speak for an hour with a newspaper reporter. There's a little anxiety with that. Not exactly, no, and I'm sure all of us can agree with that. But I thought he did a tremendous job, and I have not thanked him personally, but I should have, and I will take this opportunity to tell him I thought he did a really good job on that article. I think it enlightened a lot of people. It scared a lot of people, which was not my goal, but I thought he did a really good job.
So to the fear fact, fact or fiction, so I think at the time, anyone who had been on a ventilator, you had not been able to get them off the ventilator. Is that still the case?
That is not the case. We have had several people on ventilators, and we've got off ventilators, and they've transitioned out of the ICU. Many are extremely weak. I mean, it's not unusual for people that have a very rough course to come off and be so weak they can't lift their hands. and then they go through a tremendous amount of rehab and things. But no, we have had many successes to
Good.
date.
Good, good, good. All right, well, now we'll take some questions. Emmy, do we have any questions?
Not at this time.
Okay. All right, well, very good. Thank you so much for joining us. Our next press conference will be Monday, September the 21st. I know we normally have them at 10 o'clock, but we'll have a morning council meeting, so our press conference will begin at 1 p.m. Thank you very much and have a safe day.